is a lot to know about glaucoma, and getting a new glaucoma diagnosis can be pretty overwhelming, leaving you with a lot of questions. And there's not always time to cover it, especially in those initial exams. Here are some facts about glaucoma that your eye doctor wants you to know. Did you know that people with sleep apnea could be at greater risk for developing glaucoma? That's right, it's not just about high eye pressure. Glaucoma can also be caused by lack of oxygen to the optic nerve. And for people who suffer from sleep apnea, sometimes they can go for minutes at a time without breathing while they're sleeping. So of course that's going to cause lack of oxygen to the nerve. That can lead to permanent nerve damage and peripheral vision loss, which is what we see in glaucoma. We would love for you to know that glaucoma is very difficult to diagnose. It's not so cut and dry. What we're looking for is changes in the optic nerve, but what you'd see is changes in the optic nerve that are also causing changes in the peripheral vision. But we don't want to wait until your peripheral vision is significantly lost before we start to treat you. And sometimes the testing doesn't yield the most accurate results. And it's not always that high eye pressure means you have glaucoma. Sometimes you can also have glaucoma with low eye pressure, or sometimes you can have high eye pressure and not have glaucoma. It's really not so simple, so sometimes it takes testing over the course of many months and often repeated testing to see if there are changes to officially diagnose someone with glaucoma. Glaucoma doesn't initially cause symptoms. This is what makes it so dangerous, is that symptoms don't often occur until the disease is very advanced. The reason is that it causes changes to your peripheral vision, which we don't pay that close attention to. It'd be much more obvious if it was changing our central vision. And the other reason is these changes to peripheral vision happen so slowly and gradually that we really can't notice a change from day to day. It happens over the course of years. So some people may not notice that their peripheral vision is gone until it's really severe tunnel vision. This is why seeing your eye doctor is so important, so these things are caught early and treated quickly because of this fact. Once glaucoma causes optic nerve damage, vision cannot be restored. Unfortunately, in glaucoma, the damage to the optic nerve is permanent, and even though there are treatments available for glaucoma, those treatments are to prevent progression. They're not to restore what has already been lost. So finding glaucoma early, treating it promptly and properly, and following up regularly is the best way to protect your vision from glaucomatous damage and to prevent that permanent vision loss. Glaucoma is not the only condition that can cause changes to your peripheral vision. There are a lot of things that can affect peripheral vision, whether they're conditions that you're born with or things that develop over time. And each of these conditions tends to have a specific pattern to the visual field loss, but it's not always obvious. So if you're someone who's being monitored as a glaucoma suspect, your doctor may be trying to differentiate whether the visual field loss is due to glaucoma or to something else, because we don't want to treat glaucoma if you don't truly have it. While most types of glaucoma don't initially cause symptoms, there is one type of glaucoma that causes major symptoms, and this is an acute angle closure glaucoma attack. This causes a rapid spike in eye pressure and severe eye pain, often nausea and vomiting. People see halos or rings around lights. Their eye is usually red. Their pupil is partway dilated and it's stuck like that. This person will definitely know that there is something going on. If you're new to my channel, you might not have heard of this, but if you've been around a while, I do talk about this condition quite a bit because it's really important to get it treated very promptly if it does occur. But it's also important to realize that most types of glaucoma don't cause symptoms, so keep up with your eye doctor regularly. Fortunately, we live in a time where there are a lot of different drops available to treat glaucoma. So if one drop doesn't work for you at lowering that eye pressure, there are likely other drops that will work, or eye drops can be used in combination. That means that you can be using more than one drop on a daily basis to keep the eye pressure lowered. And that's a totally normal way to go about treating glaucoma. Your eye doctor may also want you to know that there are other treatment options available if drops don't seem to be working for you. Some people, maybe if they have severe arthritis, for example, may have difficulty putting in their eye drops, or others may have extremely hectic schedules and they are not able to travel with all of their eye drops and keep track of putting all the eye drops in at the right time. Well, there are laser treatments available that can help to increase the outflow of that eye fluid to lower the pressure so that they don't have to rely on drops alone. Another important thing to think about when it comes to eye drops is that if you are prescribed multiple drops, they need to be put into the eye at least 5 minutes apart. That gives the drop the proper amount of time to absorb, and if you put too many eye drops in at once, they're all just going to end up running down your cheek. This also goes for if you're using drops for other things, like dry eye, for example. You need to separate putting in the eye drops for glaucoma and for dry eye by at least 5 minutes so everything has the chance to absorb properly. Now that we're talking about dry eye, it's also important to realize that dry eye drops are prescribed for dryness, not for glaucoma. You may be surprised, but there are some people out there that once they're prescribed a new drop, they think they don't need to use their old one anymore. And this is where that patient-doctor communication is really important. If you're prescribed a drop for a certain eye condition, it's treating that condition. It's not necessarily treating the glaucoma. So be sure that you clear things up with your doctor, what your different drops are for, what time of day to use them, and how many times a day you should be using them. And be sure to wait at least 5 minutes between putting in different kinds of eye drops. Today's video is sponsored by me. I'd love for you to check out my new children's book. Take a look at the description below.
When you dream about the ocean, you can become friends with a jellyfish. You can breathe like magic underwater. You can talk to turtles. You can swim with a whale. What will you dream? What will you dream? What will you dream?
Some people may have really sensitive eyes or dry eyes, and they may have a lot of negative reactions to eye drops. And this is where the alternative treatments can really come in handy so that you bypass those side effects. There are also glaucoma eye drops available that are preservative-free or that have different types of preservatives than others. So if you have a negative reaction to one, you may do a little bit better with a different kind of eye drop, a different preservative, or something that is preservative-free. If your eye color is changing as an adult, this could be a sign that you may develop glaucoma. This would be pretty rare, but there is something called Fuchs heterochromic iridocyclitis that causes the eye color to change over time. It's usually in only one eye, and this eye would be more likely to develop glaucoma in the future. There are other conditions out there that make glaucoma more likely, and your doctor should be able to discuss these with you, and this is why sharing your medical history with your eye care provider is so important. Steroids can cause an increase in eye pressure, and this is especially likely in people who have already been diagnosed with glaucoma, among people with certain eye conditions. So it's really important that if you are using a steroid eye drop or steroid nasal spray or steroid medications of other kinds, that you're checking in with your eye doctor regularly. Usually it takes a couple of weeks of using a steroid for this eye pressure to start to increase, but sometimes it can happen fairly quickly, like within a few days or sometimes hours of starting a steroid medication. Topical medications are the most likely to cause these steroid spikes, and the least likely to cause a steroid spike is with an oral steroid medication. But be sure to be in communication with your eye doctor about any changes to medications that you have, and check to be sure your eye pressure isn't increasing, especially if you have glaucoma already. Comment below if any of these facts surprised you. Be sure to like and subscribe, and I hope to see you next time.